Hello and welcome to the latest PediaTrust question and answer Ask the Pediatrician webinar, welcoming your baby during a pandemic, in which we focus on pregnancy, childbirth, and those first few weeks at home with the new baby, all during a pandemic. My name is Ruben Rucoba. I am the medical director for PediaTrust and your host for tonight's session. Our panel tonight includes, and if you can give a wave so we can put a face to a name, Dr. Melissa Turner, pediatrician and Pediatric Associates of Arlington Heights in Arlington Heights. Chana Goldstein, certified lactation consultant and the head of PediaTrust Lactation Department. And our special guest, Dr. Jill Placek, OBGYN at Gynecological and Obstetric Associates, also in Arlington Heights. Our session tonight will be an hour long. We have another webinar using the same channel after this, so we're going to try and cut this off right at 7. It will be recorded, and we will be sending an email to everyone who registered for the event with a link to that recording in the next few days. We've had questions coming in for the past few weeks, and we'll get to as many of those as possible. But those of you watching tonight can also submit questions either through the chat function of the Zoom call or through Facebook Live, and we'll try and get to some of those. Dr. Placek, let's start with you. We've had a lot of questions about visitors during delivery. One mom asked, will visitors, my parents, be allowed in the waiting room while I'm in labor so my husband can give them updates? Another mom asked, is my partner allowed to stay with me during a C-section and during the entire hospital stay? And yet another mom asked, can anyone come to visit us in the hospital, including the baby's older siblings? What can you tell us about the visitor policy at the hospital that you deliver at during this pandemic?
Great question. So every hospital has its own policies, and a lot of them are very similar at this point. We've definitely learned a lot through the course of the pandemic about visitation in the hospital and what is, something that may be okay as far as risk of exposure for COVID to patients and visitors and vice versa. Northwest Community Hospital in Arlington Heights, where I deliver, currently has a slight variation from labor and delivery to the mother-baby unit. On labor and delivery, you are allowed to have that one partner with you at all times who can basically come and go as need to. So if you have other children at home, pets to let out, things like that, that person can come back and forth. You're also allowed an extra individual at that time who is a doula. So somebody who has been licensed, certified, trained in kind of labor support can also come. And I think Northwest actually recommends that they have proof of certification when they come. Once you get transferred up to the mother baby unit, you are allowed your partner to be with you again, coming, going as they please. And one additional visitor. Does not have to be a doula at that time during the day. Unfortunately, no one under the age of 18 is able to be there as a visitor unless they are the parent of the infant. So unfortunately, siblings in most cases are not going to be able to come visit at this time. But again, things are changing on a regular basis. So I recommend checking with your hospital that you'll be delivering at. Their website usually is a wealth of information, and checking with your obstetrician when you're going to deliver.
Thank you, Dr. Placek. Dr. Turner, likewise, there's lots of questions about who can visit the new baby and the parents once they're all home from the hospital. And here's a question that came in, very specific to COVID. One mom wants to know, what is the safe exposure for family meeting the baby? We have mostly COVID vaccinated family, but many work with at least one unvaccinated person, and many are out and about traveling or going to larger events than we feel comfortable with, concerts, large parties, etc. What do you say to that mom? You're on mute, Dr. Turner.
Sorry, I was trying to use my space bar and it wasn't working. So, we get a lot of questions about what are the risks, and a lot of the risks, what we need to figure out is how comfortable you are as a parent with taking risks. So I think the two different sets of people are a little different. So a vaccinated person who is working with unvaccinated individuals, so whether that's children who are unvaccinated in the case of teachers, or healthcare workers who are working with unvaccinated patients, in those scenarios, most of the time as someone who's working there, you should be protected with PPE and with mitigation efforts while you're working. Certainly having a very frank conversation about how well those mitigation efforts are in place with the people who you're, thinking about bringing into your home or visiting with your baby is important. So if they, are uncomfortable themselves, then that would be something to consider. It sounds like in those scenarios, those would be people who have similar risk thresholds for other activities though. And I think that's a different question. So if you're talking about family members whose activities during the pandemic really aren't lining up with the way that you are looking at risk. So they're doing things that you would consider very risky. That's a little bit harder because those situations you've chosen actively not to do those. And then to also, bring that, you bring that risk into your home after specifically making the choice previously not to. So I think you have to look at both of those as different types of risk, and we can never get down to zero risk. So, I think in my home, if someone wasn't, following the same similar kind of risk behavior that I was, that would be a little bit more concerning to me as a visitor than someone who was working in a situation where they were around unvaccinated individuals sometimes.
Thank you. I think it's important also to do exactly what Dr. Turner said. You have to feel comfortable with who's coming to see your baby. And if others in the family, extended family or friends take some umbrage to that, you can always blame the pediatrician, blame us. Say, well, the doctor says I have to do it this way. The doctor says we got to do this to protect the baby. It's always helpful to have a common villain, and we're more than happy to be that common villain. So blame the doctor. Hannah, here's a good one for you. If you are vaccinated while pregnant or breastfeeding, could you transfer COVID antibodies to the baby or the fetus?
That's a very good question. In fact, all of the medical professionals are recommending that pregnant and breastfeeding women get the vaccine. And we do know now that the antibodies are showing up in cord blood samples and showing up in breast milk. In fact, the American Academy of Pediatrics mentions a study that was done, they mentioned it in an article in August of this year, talking about healthcare workers who were breastfeeding at the beginning of the pandemic and what kind of antibodies they found in the milk of those moms. It's actually a fascinating study because it points to the fact that the longer mom's been breastfeeding, the more antibodies she has in her breast milk. So the answer is yes. More studies definitely need to be done in order for us to know how long those antibodies last and how much they protect the baby. But they are currently studying all of that. And for right now, we do know that it is in the cord blood and it is in the breast milk.
Thank you. Similarly, Dr. Placek, one mom asked, will getting the COVID vaccine in the first trimester still pass antibodies to the baby?
Great question. So as we just heard, we do know that cord blood samplings are testing positive at the time of delivery, which is basically representative of what baby is getting and what is in the baby's bloodstream itself. So it's a non-invasive way to actually test baby's blood by testing the cord blood right after delivery. We do know that these antibodies are there. It's the $1 million question as far as how long they're going to last. And this is kind of hot off the press data when it comes to boosters to trying to really increase that immunity. But getting vaccinated in the first trimester very likely will continue to pass some of those antibodies on, but we'll be talking a little bit more later on about boosters specifically.
Thank you. Dr. Turner, let's go back to the topic of visitors coming to see the baby once the baby comes home. Let's take COVID out of the equation. What's your typical advice for visitors in the newborn period? What did you tell parents before this pandemic hit?
Yeah, and the pandemic changed the advice, I think because it shifted the focus towards COVID, but really in the first 2 months of life, the advice from your pediatrician has always been to limit contact, definitely with people who might be sick, but also not to have significant amounts of contact with people. And the reason that is that in the first 2 months of life, if your newborn gets sick, we worry and know that they may have a serious bacterial infection. It's very difficult to tell the difference between a newborn with a serious bacterial infection or one who it just has a little cold that they got from their new cousin. And the reason that is that newborns don't really have a lot of ways to show us that they're sick. And the main one is going to be a fever. Sometimes they're not eating well or very fussy, but for the most part, we use fever as our way that we decide if a newborn is sick. So if you have a visitor who happens to have a little bit of a cold or runny nose, some of those might be dangerous for the infant, particularly RSV or flu, which are the seasons that are coming up, although RSV this year started in the summer, which was very unusual. And we don't know what's going to happen with the flu season. As international travel patterns are a little different. Regional outbreaks of flu seem to be starting in unusual places this year for the flu season. So I think it is going to really kind of take us by surprise. But outside of those illnesses, even if it is just a simple cold, if your newborn gets a fever, they typically are admitted to the hospital because of that, or at least get blood work, sometimes spinal taps, antibiotics, things like that. So that's why we've always kind of suggested that we don't have a huge amount of visitors in those first 2 months.
Thank you. Hannah, one mom wonders, what are the safety protocols if the mother is COVID positive? Is breastfeeding still an option?
Oh, yes, very good question. And we wondered about that in the very beginning of the pandemic. We now know that breastfeeding is best. We know that for many reasons that breastfeeding has always been best for mom and for baby. But now we know that as long as mom is making sure to wear a mask when she's caring for the baby, and she's washing her hands very well with soap and water, and if no soap and water is available, she's using hand sanitizer. As long as she's practicing those good sanitary practices, hand washing, masking, then it is definitely best for her to be breastfeeding and should not cause any interruption between mom and baby and their breastfeeding journey.
Thank you. Dr. Placek, we got this question that came in last week. Do you recommend the third vaccination when pregnant or trying to conceive? What do you say?
Great question. So this is relatively emerging data, and there's even more data that's coming out again today, but definitely yes, for those who've received the Pfizer vaccine, they do categorize pregnancy as one of the high-risk categories. So people over the age of 65, chronic lung conditions, diabetes, people who are pregnant have a 3 times higher rate of ICU admission when they get COVID compared to their non-pregnant counterparts. So the CDC absolutely recognizes pregnancy or trying to conceive or within 42 days of pregnancy is where they put the limit as well. So if you have been vaccinated with the Pfizer vaccine greater than 6 months ago from dose number 2 and you're pregnant, trying to conceive, or just recently not pregnant, I do recommend getting the 3rd dose. Additionally, we just learned today that the FDA is going to the CDC with recommendations if you received Moderna and Johnson & Johnson for boosters as well there. So tomorrow, we should be hearing a little bit more information about whether the CDC agrees with the FDA's recommendation, but there's going to be more coming. So check with your obstetricians for the updates as that goes through the proper channels.
Thank you. I think the important point there is pregnancy is a high-risk condition. So
Absolutely.
You need to be protected and protect your baby as well.
And I think,
all right, speaking of vaccines, Dr. Turner, what is your stance on the COVID vaccination, both for those older siblings in the home of the newborn and the new parents?
So, the COVID vaccines are a safe and effective way to really decrease your risk for COVID and decrease the risk that your family will be exposed, that your newborn will be exposed, and that you will be exposed. And I think, back to Jill's point about pregnancy, and I think it was, I can't remember, Jill, how many days after pregnancy it was that you
42.
were 42. So, in that same vein of those 2 months that we talk about with the newborns being at risk, you are also at risk. And I think that gets lost as mothers, that we worry so much about our infants and don't realize in this scenario, you're actually a higher risk from COVID. Now, influenza, RSV, there's other things that maybe you wouldn't be as high risk as your newborn. But all these questions, when we talk about who should visit the baby, it's who should visit you too. So I think that is important. But yeah, back to the COVID vaccine question, we give the vaccine in our office for siblings, and we're very excited. I'm excited about vaccinating my own kids coming up here soon, hopefully, my 5 and 9-year-old. It's been a long time coming. So we're all really confident and very happy with how the vaccines have been going in kids.
Great. Yes, it is safe. It is effective. So we recommend it for sure. All right. Chana, you keep getting these what if questions. One mom worries, what if I catch COVID while I'm breastfeeding? Then no.
That's a good question. If you've caught COVID at any point while you're breastfeeding, again, it's really important to make sure you're wearing a mask when you handle the baby and continue to wash your hands with soap and water. If you don't feel well enough to care for the baby between feedings, then, for sure someone else can step in, care for the baby, change the diaper. But there's no reason to say why that you cannot take care of the baby. As long as you are wearing a mask and washing your hands with soap and water, you can continue to breastfeed, you can continue to care for the baby, as long as you're feeling up to it.
Right. And to reiterate, the virus does not transfer through the breast milk. It's only transferred, like it is for the rest of us, respiratorily. So if mom wears a mask, tries to keep that contact as limited as possible, things should be good.
Right. And if anything, if mom is making antibodies, whether she, got COVID after being vaccinated, or she, wasn't vaccinated and got COVID, she's making antibodies and passing those antibodies, just like for other infections. She is passing those antibodies to the baby through her breast milk. So it is definitely wise to continue breastfeeding.
Very good. So the answer is always keep breastfeeding, right?
Keep breastfeeding.
Absolutely. Good. All right. Here's a good question for Dr. Placek. Here's a what if for you. What will happen if I test positive for COVID when I show up at the hospital to deliver the baby?
I was going to make a joke, but I don't want to, that people would be sent home and, come back when you're COVID free. That's not the reality of what happens in hospitals. So regardless of whether or not you're in labor, if your obstetrician has determined that it is necessary for you to deliver your baby and they're there to have your baby, you're going to have your baby. They do testing if you have a planned procedure, at least the hospital I work at. Oftentimes we'll test a couple days ahead of time to decrease the risk of it being such a shock. But when you come in, there's really going to be no major difference on the patient side. You'll be asked to wear a mask in the room when you've got people in there, the hospital staff, nursing, physician, et cetera. From a physician standpoint, not a ton of information is clear for vaccinated physicians and nurses about continuing to wear, but most likely I would probably be wearing an N95 and all the gear that we're so accustomed to wearing and sweat underneath. But the reality is you're still going to be very much cared for by the labor and delivery staff, the mother baby staff. We will be coming in and out to attend to all your needs. And the reality is that from your aspect and your experience, the goal is to have it be no different whatsoever, whether you're testing COVID positive or not. That being said, obviously we will make recommendations, as Chana has talked about breastfeeding and care and making sure that we're minimizing risk and exposure to baby. But for my hope, aside from that initial shock of hearing about that positive test, I hope that will be all of it and that will be the least of your worries when you're there in the hospital.
Thank you. I got to say, a much more humane approach. When the pandemic first started, there was separation of baby and mom. There was a lot of that, but now it seems like it's a little more humane a much better situation for everybody.
We've
involved.
learned a lot, absolutely.
All right, Dr. Turner, we discussed visitors coming to the home, but what about taking the baby out? One mom asked, how much can I bring my baby out in public? I was vaccinated in my second trimester, but since my baby can't wear a mask, I don't know how safe anything indoors is for my baby, such as grocery store, library, etc. And as a reminder, sometimes with older siblings, you have to leave the house and go to these places. So what's your advice for that mom?
So, nothing is zero risk, but getting out of the house with your baby is really important for the baby, and it's important for your mental health. So at the very least, making sure you're going outside and taking walks is important. So my answer for should you go out is yes. Go out every day. And I think most pediatricians get their kids out in, sub-zero weather. It's all about putting the right outfit on is really the key when it comes to going outside. Get rain boots, umbrella. We want people to go outside. We want them to, do things to make them feel a little bit less shocked by the kind of bringing a baby home, because there's a lot of changes going on there, and getting some things that feel a little bit more normal is important. A newborn in a, certain type of setting where you are indoors and they're strangers, but the distance is far apart, the air quality is good. We know now, looking at typical grocery store settings and things like libraries, that places where you don't linger and take off your mask indoors with good air quality and you're not there very long are relatively low risk. And again, there's never zero, but some of those activities certainly could be okay. In some ways, again, going back to our RSV and flu, those things possibly could be a little bit more, concerning with like touch surfaces and things like that. But, for the most part, if it's an activity that you can do briefly and, on a weekday while people at work and kids are at school, you may feel comfortable in those things. And always, feel ready to bail. I mean, babies have all sorts of needs that make that really predictably unpredictable, that you will need to bail anyway.
Thank you. All right, Hannah, this is a very good question, and I think one that's very relevant nowadays. One mom wants to know, is it safe to get milk from milk banks during COVID?
So milk banks are very, very helpful. We're lucky to have one here in the Midwest. And they provide donor milk, especially for babies in a NICU situation, where we know that a NICU baby will definitely thrive on breast milk. But there are people who would prefer to get milk from a milk bank if they need to supplement even once they've gone home. And if they're not building a full milk supply, sometimes they need to get some donor milk instead of using formula. And milk banks use the same precautions as a blood bank. So it is the safest way to procure donor milk, because that the moms have been screened and the milk has been tested. It's actually pasteurized. So it is the safest way to get some donor milk if for some reason your baby needs more milk than you can provide for the baby.
I will also say, from an obstetrician standpoint, when people are donating, especially to the milk bank you're discussing, I actually have to fill out a screening form as part of their application to be eligible to donate. So I actually, with the patient's permission, fill out some of their medical history as well to help determine if they are a candidate for donating.
Good to know. Thank you. Dr. Placek, this question came in live tonight, and it's about boosters. You spoke about that, for a pregnant mom. The question is this: for the booster, is there any formal recommendation about when to take it? For example, closest to delivery, or right now, if it's been more than 6 months?
So if you are currently pregnant, those risk factors that make you high risk are still going on. So I don't think there's any benefit to waiting because that exposure risk is continuing and it's ongoing during your pregnancy. So if you've gotten the Pfizer vaccine and it's been more than 6 months, I would definitely get it now. And that boost will actually really be there before the baby is born. And you get more antibodies passing through the placenta and more antibodies into the breast milk as well. With the Moderna vaccine, again, this isn't fully approved yet, but I can't see why it wouldn't be based on the data. It sounds like Moderna will be a similar situation where if they're recommending boosters, it will be 6 months. Johnson & Johnson, uniquely, they're recommending boosters faster. So for the pregnant ladies who've gotten Johnson & Johnson, keep an eye out because they will recommend a booster in under the 6 month. They're looking at about 2 months. But again, that's provisional data. We will hopefully hear tomorrow if that's actually going to go into effect with the CDC.
Thank you. All right, here's a very common question that we got asked in a variety of different ways. This is for Dr. Turner. Our toddler goes to preschool. How should we manage her interactions with the newborn sister at home?
Great. I had a few jokes about putting them away too, but when you have a toddler in the house, there's not much you can do. Depends on your toddler. I always tell people there's 2 ways it can go. Your toddler may be extremely interested in their new sibling, or they may completely ignore them. And I don't feel like there's very much in between. It's like all or nothing with the toddlers if they're going to interact with their new baby. You can work on ahead of time. Everyone, talks about the baby coming, get that baby doll. When we kiss baby, we kiss on the toes. Okay. So don't get face by face and practice, like if we're going to do something with baby, that we're going to kind of stay by the feet. Obviously, if your toddler is sick, even that's probably too much interaction, right? I mean, by the feet is basically in your face when it comes to a toddler. So making sure that if there is a runny nose, that you're, keeping them away, fevers. It's hard to know because a lot of times with viral illnesses, the ones that pass around daycares, it's because they're contagious before you're sick, which we see with COVID. I think everyone understands viruses so much better now. And a lot of the ones that we talk about are contagious for extremely variable amounts of time as well. So, it's very difficult for a daycare to say, stay home for anywhere from 4 to 28 days. That's not what's going to happen. So they will get colds this respiratory season, even if they're wearing masks at daycare or preschool. Have them wash their hands, have them stay away from baby's face for sure. That actually goes too for parents. It's one of the things that I think that we all mention in passing or hope that parents know, but when it comes to babies, anytime we're really try to stay away from their face when it comes to kissing and things like that. That's another, infectious disease risk, and in particular, that one's for cold sores, which are much more serious in a newborn than just a cold sore. So it's good for parents too, to kind of remember that. Just kisses on the toes, they're very cute too when it comes to photo opportunities.
Thank you. It was sage advice. All right, Hannah, here's a question that has absolutely nothing to do with COVID. And the question is this: if I'm simultaneously feeding both a newborn and a 14-month-old, do you have any recommendations to handle the new demand? First, let me say that woman deserves a trophy,
Medal. Yes.
First of all. But then what's your answer to the question?
Okay, so that's actually called tandem breastfeeding. And they definitely deserve a reward. But the rule of thumb is really the newborn has to breastfeed first. The toddler is eating solids. The toddler can drink from a cup. They may kind of graze at the breast where they may come running back to mom, nurse for 2 minutes and run away and play again, or crawl away and play again. But this is not the main source of their nutrition at that age. So newborn always nurses first. And it can be a lovely experience for the whole family, but it's always the newborn that nurses first, and then the toddler can come have a snack. But that way we know that the baby is getting the majority of the nutrition.
Good point. Good point. That the toddler has lots of other ways to get nutrition in.
Absolutely.
Okay.
For them,
Absolutely.
it's TLC and not nutrition. So.
Right. Absolutely. Okay. Dr. Placek, one mom wants to know, should my partner and I quarantine for a certain period of time before our due date? For example, no in-store grocery shopping, no seeing family, etc. What do you say to that, mom?
This is a great question. So this has actually changed during the course of the pandemic as well. Before vaccines, we definitely were recommending people lay low. We had people quarantine between getting a COVID test and having a C-section or going in for a scheduled delivery. With vaccines, things have lightened up a little bit, but I think the main thing to look at is kind of what's your risk category overall? What is your vaccination status and the vaccination status of those around you? What's going on in the microcosm around you as well. So looking at your, general positivity rate near you. Just to give you a little bit of information, here in Chicago, suburban Chicago, we're doing pretty well. Our positivity rate currently is around 2.5 percentile. And to compare that back to when it got really bad in November of 2020, we were looking at more at about 17.8 percentile positivity of tests being done without a really dramatic change in the number of tests being done here. So we're doing a really good job to try to mitigate risk as much as we can here. So for simple trips to the grocery store, wear your mask, and hopefully everybody is masked in the grocery store. I think overall that's relatively low risk, places where you can socially distance. Now, if you've got family members who have, chosen not to get vaccinated and are really big about high risk areas, we talked a little bit about this with Dr. Turner, trying to minimize that risk as much as you can, because again, there's nothing more jarring when you go in to deliver your baby and you find out, oh my goodness, I'm positive, and the impact on baby. Yes, things will be okay as we've discussed here. However, we want to try to decrease your risk overall and the risk of those around you, including your newborn.
Thank you. Dr. Turner, this is a somewhat related question, and it's not about taking the baby out. It's really about bringing the germs in. One mom writes, I'm going back to work. I feel like I should be wearing my mask around my newborn all the time after I go back to work. Is that truly necessary?
So, as parents, we would be bad parents if we didn't worry about our children, right? Worrying about them is what keeps us, interested in their well-being, and, but wearing a mask inside your own home, it hasn't been recommended for people who are going out to work. Now, certainly if you are in a extremely high-risk position, if you are a, intensive care nurse or a respiratory therapist, you probably have already had COVID and probably are vaccinated, but those are positions where certainly you may feel like you had an exposure where you're just kind of biding your time and waiting to see. So in that scenario, maybe you would want to wear a mask, but I think for the average new mom and at a typical job where you'd be wearing your mask all day, I think that would not be necessary.
Thank you. Anna, one mom wants to know, and then here's another non-COVID question. Is it possible to pump too much if you have an oversupply of milk?
Yes. Okay, so if mom suspects that she has an oversupply, we definitely encourage her to make an appointment to come in and see one of our lactation consultants. And IBCLC would definitely work with her to determine if it's truly an oversupply or if her body still hasn't adjusted to how much milk the baby needs. But the answer to that specific question is yes, you can pump too much. When you pump too much, you can perpetuate the problem and continue to have an oversupply and make the situation worse. But you can also actually, if you pump the wrong way and you pump too much, you could actually decrease your milk supply to a point where it's not enough for the baby. So we would want to see a mom who thinks she has an oversupply so that we can work with her on decreasing her milk supply to the point where it is sufficient and adequate for her baby in order for her baby to grow appropriately.
So as the one member here tonight who actually cannot breastfeed, I am going to say one thing, and that is everybody assumes that it is the most quote unquote natural thing in the world, but it really isn't. There's a lot that has to go on, right? Between
Yes,
the baby and the latch and the mom and the way
yes,
the nipple fits in the mouth and all of that.
yes,
And I've
yes,
seen lots of times where parents, moms, give up breastfeeding because they're just not shown how to do this the right way. And that's something that Chana and her team can do for you, and do it safely and do it very well. So for this or any other concerns about breastfeeding, I recommend a visit with a lactation consultant at PediaTrust, because they can really help solve a lot of these problems very quickly and very easily, because this is what they do all day long. So
yes,
keep
yes,
that in mind.
absolutely. And what one cardinal rule is breastfeeding should not hurt. Even in the beginning, it should
right.
not hurt. So if it's
Right.
hurting,
Something's wrong.
come see us and we'll be
Right.
happy to help you, because it should not hurt.
Right. And,
When
and
you were
don't
in the
assume, and
Sorry.
don't assume that you're doing it wrong if it's not working, because this is not just a natural thing.
No, I mean,
takes
it is
work.
natural, but it's learned. So
Right.
it's natural. The baby has been born
Correct.
with reflexes to help them to breastfeed. And mom's body is ready to breastfeed. So it is natural, but they both have to learn how to do it. And we're more than happy to walk you through all of that. And it's really important to recognize that it should not hurt. That is so important. Some women think that, oh my goodness, it's going to hurt for the first 6 weeks. It should not hurt at all.
And one of the things I always tell parents, tell moms, is moms and dads both would have been around lactating women all of the time. Like, that's what's so different, is that your sisters would have been, your mom would probably still be lactating the first time you have your first child. All of this, we had a tribe of women around us. And the first experience that most moms have with breastfeeding is their own child, not seeing someone else do it. And I think that's something where that kind of like learned natural behavior, you would have been learning it. And that's why, it's important to support moms who are breastfeeding and allow breastfeeding in public and breastfeeding with your friends. We always want, parents to feel supported breastfeeding or bottle feeding, but we need to, to learn from each other. And that's why.
Absolutely. All right. So Dr. Placek, one mom wonders, I am almost 35 years old. Is it safe to have a baby? And I'm going to point out that in the Bible, Sarah, Abraham's wife, had a baby when she was 90. I'm just putting that out there. So FYI.
Miracles happen, that's for sure.
It does. It happened once, could happen again.
Absolutely. So I hear this question and I laugh a little bit. It's never safe to have a baby. That being said, your body goes through really amazing changes, and age is one factor, but the reality is even a 19-year-old who's having a pregnancy that, was planned and in the best circumstances, even she has dramatic risk factors. Your body goes through such incredible changes. Your respiratory rate increases by 40%. The tidal volume, or how much you're breathing with every breath, increases by 40%. Your blood volume doubles, which oftentimes can cause a little bit of anemia. So if anybody's ever had a pregnancy before and been instructed to take iron, that's why. And in a normal delivery, if no complications whatsoever, the average blood loss of a delivery is about 0.5 liter for a vaginal delivery and 1 liter for a delivery. So there are a lot of risk factors that go into carrying a child and delivering a child. Is the age of 35 scary to me as an obstetrician? No. Unfortunately, you get this ugly label that was made by some geriatrician a long time ago, where they called geriatric pregnancy or advanced maternal age, are the labels that we unfortunately get ascribed to. And I'm over 35, so I can say these. But what I will tell you is all that is describing is this rapid rate of change that's happening for a woman's fertility, for her risk of diabetes, her risk of preeclampsia, risk of miscarriage. At 40 and above, a rate of Down syndrome even is about 1 in 100, whereas in your 20s, it's 1 in 1,125. So there's basically this rapid rate of change where they had to put a pinpoint somewhere saying, hey, here's where the risk factors are. The benefit when you are 35 or older is sometimes by getting labeled with these horrible names that we throw out there, it actually enables you to a little bit more advanced testing. So cell-free DNA or non-invasive prenatal screening oftentimes is an automatic go from insurance companies where they may want a little bit more information from me as an obstetrician about what risk factors and is this expensive test really worthwhile for us to cover. But there is nothing magical that happens between 34 and a half years of age and 35 years of age. It's just this kind of increasing trend. Your obstetricians have been trained all throughout their residency programs and throughout their careers to manage the risk factors that come with pregnancies of people who are 35, 36, 38. And the oldest woman I've ever had who conceived naturally on her own was 45 years old. And I have taken care of women even older than that who've gone through assistive reproductive technology. So if another baby is in your plan for your family, absolutely go ahead and try for it and have a conversation with your obstetrician if you have specific questions about the risk factors you possess.
Thank you. Dr. Turner, this next question is very specific, but the situation to which it refers comes up frequently. So I'd like to get your feedback. One mom writes, we're traveling to my native country, India. My baby is just 2 months old. What are the precautions to be taken during COVID? And I guess, you can certainly address what you know about India, but just in general, taking a newborn baby out of the country, what would you say to that situation?
Yeah, so, international travel is something that definitely comes up. It came up before the pandemic as well. My advice typically with international travel with a 2-month-old is to try to come in at around 6 weeks, right at 6 weeks or after for a travel visit with your physician to discuss the specific area you're going to. At 6 weeks, we can actually start the routine immunizations for kids. I had some travel plans with my 6-month-old. I wanted to make sure that I got all of her vaccines done before that visit, before that travel, sorry. So we started early and did them a little bit faster. So that's something that you could talk about. When you do a travel visit, you would oftentimes have them talk about specific factors to the international location that you're going to. So in India, there's risk for malaria. It's a common travel visit that we do, so we know that one pretty easily. So risk for malaria and talking about any prophylactic medications kids might need. But sometimes South America, we might need a cholera vaccine. And so kind of going through those. As a parent, you can actually look on the CDC's website for the travel recommendations as well, which can kind of give you a little taste ahead of time. For Europe, we also do early MMR vaccine. So there's a lot of reasons to call your pediatrician if you're planning on traveling internationally. And then airplane safety. So the AAP does recommend if you're on an airplane with someone who could be a lap infant, it's obviously much more expensive to get them a seat, but it is safer. So it is recommended that children have their own seat on airplanes, and also recommended that they're not on the aisle. Sometimes they won't even let you put a child on the aisle, but that really, the most common injury that you see in airplanes is actually burns from coffee coming down the aisle. So that's why kids really shouldn't be on the aisle as well. So, and also, I mean, transmission of respiratory illnesses and COVID are less further in on a plane.
Just to add to what Dr. Turner is saying, the one immunization that is contraindicated in breastfeeding is yellow fever. So if that's on the list for your when you go and check out the CDC travel website, maybe pick a different location if you're breastfeeding.
I'll say good luck getting that one. I think that one's been on back order for a couple years in the US.
That's hard to get, yeah.
Really hard to get that one.
Right. Okay. Hannah, so this question came in live and it's in direct response to our conversation a little bit earlier. And one mom wrote, oh my God, I'm assuming she means breastfeeding, was so painful, in all capital letters, with my first 2 kids. I had thrush, mastitis, infections. So first of all, kudos to her for breastfeeding. Second, if her first one had all of those issues, but she persisted. So what do you tell that mom? What advice do you have if she's pregnant again, to make the third breastfeeding experience a little bit better? Is there any way to prevent some of those things?
Sure, absolutely. So first of all, I would definitely recommend if you start out breastfeeding your new baby and it's painful, please don't hesitate to call. We can see you as early as your first pediatrician visit. Usually, we can try to coordinate that so that you could be seen the same day or the next day. So again, if you're experiencing pain with your new baby, we would want you to come in so that we can help you. Very likely it's just tweaking the latch and helping the baby get into a better position, a deeper latch. These are things that we do every day to help moms who are coming to see us with sore nipples or painful breastfeeding. In terms of thrush, thrush is a yeast infection. There's yeast everywhere. So good hand washing, obviously, we recommend that all the time. But if you know that you have a history of frequent yeast infections, then definitely be extra conscientious about good hand washing, good hygiene, and same thing with mastitis. We would definitely be able to work with you and teach you some of the things that you can do to prevent recurrent plugged ducts and possibility of mastitis. So we're more than happy. We're here for you. We definitely would be happy to make this experience very different from your past experiences with breastfeeding.
And just to show that this isn't a commercial for PediaTrust, every hospital has lactation consultants there as well. So, if you're in for 2 days with a normal delivery or longer with a C-section, don't hesitate to use the lactation consultants at the hospital so that, from the very first get-go, you've got some help to try and prevent some of these issues as well, right?
Absolutely. I mean, different hospitals have different professionals who will help with breastfeeding. There unfortunately is no standardization yet and no licensing of breastfeeding assistants. So we're hoping that soon we will have credentials and licensing so that it'll be more standardized and we can guarantee the level of education of their lactation consultant. But in general, I would ask to see an IBCLC, which is an internationally board certified lactation consultant, and all the lactation consultants at PediaTrust are IBCLCs.
Good to know. All right, thank you. All right, Dr. Placek, here's a question for you. Somewhat a personal question, it sounds like, but I'm curious what your advice is. Is there an ideal age gap between your first and second child? And another mom writes, is 7 years difference too much between kids? What do you say?
Great question. So as far as an ideal age gap, I'm going to say probably not. There are some conditions that women may experience during pregnancy that really make it medically beneficial to not have children too close together. Irish twin sounds great. You rip the Band-Aid off with having kids, and the reality is that they're still very close in age for the rest of their lives. You finish potty training with one, you start with the next, then puberty, and heaven help you when you have to pay for college. But in all seriousness, the biggest concern would be having children closer together rather than further apart. 7 years definitely is not too long, especially if, you think you may be done and then you think about it again and say, you know what, my family's not complete yet. I want to have another. We talked about risk factors with advanced maternal age. So there are some additional risks there. But your obstetrician absolutely is more than capable of monitoring for these risky conditions and treating them whenever they arise. One of the other conditions that may be different when you have two children far in a huge lag is some of your equipment may be outdated, and Dr. Turner can speak to this specifically. The boppy loungers, those are apparently good only for cats to use at this point because they've definitely done a recall on that. I loved using the rock and play. That's long gone. I had to trash mine. So definitely check to see what safety things they're constantly changing. So if you've had a big lag between kids. Double check your expiration dates on your car seats and anything else that Dr. Turner can recommend. We may be a little tired. It may require a little bit more caffeine for us to kind of get through those newborn years, but definitely there's no time that's too late if your body is able to handle it, and talk to your obstetrician about what risk factors you may have.
Thank you.
And, I think as a pediatrician, I love the big kids with the babies. They, the 7-year-old is typically so sweet with their little newborn siblings. And, we see that a lot. And I totally agree with the gear. My kids are like 4.5 years apart, and, most of my stuff had expired, or, there wasn't a lot that I could use, but the gear gets better. It's way better. Everything is, much, much better every 7-year age gap. We come a long way. So I'm jealous now when the moms come in with their different little toys. I'm like, I don't know why I didn't think of that, right? It's what everyone says. So, close together, far apart, if you feel like you have more love to give and you want more kids, like, go for it.
Absolutely. And if the kid's 7 now, in a few more years, you got a built-in babysitter. So go for it. All right, Dr. Turner, here's one for you. It's a question for our times. My mother-in-law wants to host a baby shower for me, but she doesn't want to do a Zoom version. Is there a way to have a safe get-together inside now that it's getting colder?
So there's no zero risk inside or even outside, activity. We very occasionally will get outside COVID spread as well. So there's no zero risk baby shower, unless you are doing a Zoom baby shower, and then you risk alienating your mother-in-law, it sounds like. But for something like that, inside for a long time, probably eating, with people who are probably not going to keep a 6-foot distance. You may be able to limit it to vaccinated guests, possibly vaccinated guests who've tested negative for COVID in a certain amount of time. But the indoor baby shower is a much higher risk than a Zoom shower. So if your dream baby shower was a low risk Zoom shower, it's one of many times where you may have some parenting conflict with the grandparent. It happens a lot. And I used to love when we could have a lot of people in the room. I'd always say, bring grandma with. It's one of those things where Ruben said, we're happy to be the bad guys. I'm happy to talk it through in person. When you parent and talk about like age gaps, this is a big age gap. A lot has changed since our parents parented. And to hear that the way that you did something wasn't safe is very internally traumatic to grandparents. And so, they're all like, well, you were okay. Well, you were okay. That's just a natural response. And we're always happy to be the bad guys. And if you have a dream Zoom safe shower you want to do, you got to just start like that ripping the Band-Aid comment off from Jill. Rip the Band-Aid off. There's going to be a lot of these conflicts probably with your mother-in-law.
Absolutely. Blame us. All right. Let's see now. This next question is for Chana. And this one also came in live tonight. And it is, can you breastfeed while pregnant? And will your supply decrease if you breastfeed while pregnant?
You can breastfeed while pregnant. As Dr. Placek said, was talking about Irish twins. There are moms who do get pregnant pretty soon after having a baby. And they survive. But yes, you can breastfeed, and very likely you will notice a dip in your milk supply. Breastfeeding is very hormonally driven. So you can imagine, just like pregnancy is hormonally driven, there will be some interference. And we can go into details, if anybody's really wants to know exactly what the chemical hormone issue is. But the answer is yes, you can try to breastfeed while you're pregnant, and it probably will have an impact on your breast milk milk supply.
I
Thank
would
you.
recommend women who are breastfeeding during pregnancy, just check in with their obstetricians and let them know. Later on in the pregnancy, we do see oxytocin receptors increase on the uterus. So preterm contractions from nipple
Yes.
stimulation is something that can occur. Again, it does not mean that you cannot, but depending on what your risk factor status is, later on in the pregnancy, some conditions, some providers may actually recommend trying to wean a little bit when you get a little over halfway through. So just check with your doc.
Very
Good
good point. Sorry, I didn't mention that.
No, not at all.
Great point.
All right, Dr. Placek, we've talked a lot about COVID, but we haven't actually mentioned, is there any real risk of COVID to the fetus? What can you tell us about that?
Great question. So the good news on this is that we have seen babies test positive for COVID shortly after delivery. What we don't know is there much risk from the pregnancy, or is this one of the circumstances where, and it seems like we think it's more likely to occur after delivery with exposure around from respiratory droplets, et cetera, like we talked about. Fortunately, babies who are testing positive shortly after delivery tend to have very mild or no symptoms whatsoever. The only reason we know is most likely they were being tested because of an exposure. There have been some very rare case reports of severe severe infections of the newborn. But again, this is extraordinarily rare, and these cases are being looked at very closely. But I've seen nothing more than 1 or 2 case reports coming through the literature when I was trying to evaluate for this question to be able to best answer it. But from what we're seeing, if there are infections, it tends to be relatively mild. And we don't see a congenital neonatal syndrome like we do for other viruses like Zika. So that's the good news there.
All right, we have time for one more question, but I do want to point out that in the chat function of the Zoom call, there's several links to important information about traveling with a baby, flying with a baby, flying or traveling when you're pregnant, and also some additional breastfeeding resources too. So if you want to look on the chat, you can do that. And again, you can do that on the recording as well. But check on the chat now for those links, which are all very helpful. All right, so our last question for the night is one for Dr. Turner. One mom wrote in with this question: I'm due in February. What happens when my 7-year-old gets COVID at school and I have a newborn baby at home?
So, well, I'm really hopeful that by February, your 7-year-old will be vaccinated. So hopefully that will be the case. We do have this happen. We've had this happen throughout the pandemic where, one family member, a child, before teenagers were vaccinated, or one child brings COVID home. And the recommendation is to attempt to isolate. A 7-year-old is going to be hard to isolate. So usually our advice would be to try to have one parent with your 7-year-old and the other parent with the newborn. In some houses, that's not going to work. And so we do our best. We wear our masks, we wash our hands, we keep the best distance we can. And the newborn is much easier to control than the 7-year-old, obviously. So the newborn can, be in their area with the parent and kind of coming back and forth. But hopefully that wouldn't be something. Hopefully we're not dealing with that too much in February. The other thing is to remember, again, mom is the higher risk person there. So when we're making those decisions about which parent is going to be around a 7-year-old with COVID, if you have a partner who doesn't have other risk factors, that would play in as well.
And the other thing I would mention is things can dramatically change between now and February. I mean, the end of February is 4 months away. 4 months ago, we hadn't even heard of the Delta variant at this point. So it is something that we do know about this virus, is that it is constantly changing. So if that situation does come up in February or March or whenever, call your pediatrician. Even if the 7-year-old isn't sick enough to be seen, there may be some different advice that we have to give you, because like I said, the one thing we do know is it's always changing. So just, call your Pediatrist doctor and find out if there's any other advice as well. All right, it's 7 o'clock, so we're going to wrap this up. I want to thank all of our panelists, Dr. Turner, Dr. Placek, and Hannah Goldstein. Thank you very much This was a lively discussion, and I think a lot of good information imparted tonight. As a reminder, again, everybody who signed up or registered for this event will be getting an email in the next few days with a link to the recording, and you can watch it all again if you missed anything. And be sure to pass that link on to others that you think might benefit from it as well. Thanks again to everybody who was with us tonight in our audience and on the panel. And I hope everybody has a safe and healthy fall and winter. Thanks a lot. Take care.